So first of all, I wanted to introduce you to the Wollongong Hospital. As you can see, it's been growing over time, and we've just had a major recent upgrade. The Illawarra is also experiencing an upgrade and growing over time as people from around the Sydney region are moving down into our area. So the research that I'm doing is looking to support the patients that we're seeing at the Illawarra Cancer Care Centre, as well as the Wollongong Hospital, the patients that come down and patients that we have existing who have cancer. So to enable improvement, we need to better understand our cohort of patients, and we also need to better understand the care that we're providing them. Has it changed over time to keep up with the changes that we're actually seeing? So when I was thinking about this and how would I look at and judge these changes that are happening and what is actually going on at our hospital, I looked at the statistics that are put out by the government, and they looked at 3 areas. So we looked at the number of people that were diagnosed in 2018, it's the estimated guess. The people who we think, the number of cases that will come in 2018, and also how many deaths that we would have. So by doing that, we want to look at also the chances of survival between 2009 to 2013 to compare them to what we've also been told by the government. In the Illawarra, the Prompt Service has estimated that we have around about, going through our hospital and our cancer care centre, about 37,000 new cases in the Illawarra and the Shoalhaven. So I sort of thought, wow, that's a lot. So I also then started to think about survivorship. How many new cases come through the hospital? How many survivors do we actually have? We don't really know. We sort of have bits and pieces of information, but we don't know the full story. And how many people does the hospital and the cancer care centre support? So the question that I've asked is, what are the psychosocial demographics and the service needs of patients at the Wollongong Hospital and the Cancer Care Centre? So the aim of the research is to look at the number of patients that we see if they have increased over time between 2011 and now, to see if the numbers reflect that the pressure that we're actually feeling as a social worker, who I am, and is that feeling of pressure, is that supported by the numbers that we're seeing? And what are the social work referral issues? What are the complexities? And has that complexity increased over time? Do some patients, and this is what's near and dear to my heart, do some patients miss out on service delivery due to medical teams not understanding exactly what a social worker does, and also what psychosocial need is actually out there, and what are those needs of cancer patients? So basically, when I looked at the literature, I looked specifically at the theme of unmet needs. And what I found was that it's been written a lot about, and basically that there's five areas: the psychologic, health systems in education, physical daily living, patient care and support, and sexuality. That was by Fisher, but the cancer guidelines are physical, psychological, social, spiritual and educational. So the methodology that I'll be using, first of all, Okay, So, first thing I'm going to be doing in the method is it'll be a longitudinal design using demographic data to see what changes have occurred since when we began using Mosaic in 2011. We're going to check the data in the electronic medical records and the care register. We're also going to use data mining patient records biannually in 2011, 13, 15 and 17 as a qualitative side. And we're going to look at the charts, a few charts in each year, to look at the psychosocial assessments that have been carried out to see what we've actually been looking at, what we've been capturing and what those needs are. So from a qualitative perspective, they're going to be randomly chosen files. They're going to have at least 2 admissions and in each of the biannual years. The social issues I'll be looking at is things like housing, their financial status, social isolation and mental health issues. Then they're going to be coded using inductive methods and thematically themed and analysed. So the data will be chunked until we get down to a chunkable area. So with the quantitative data, we're going to look at the demographic survey. We're going to audit to inform us of how many cancer patients we actually have at the Wollongong Hospital. I want to know who they are, what types of cancer they have, and we're going to extract data from each of the nominated years for comparison to see if there's any changes in the types of cancer that we're seeing. And then from that, we're going to actually identify possible improvements in our service delivery, gaps in the research and further research themes is my hope that we can, this is a beginning of the research journey for me, and I'm hoping that it's going to lead into more meatier subjects that we can use to actually improve what we do. So I suppose the considerations that we have is that the Cancer Council guidelines are looking at, again, those 5 domains: physical, psychological, social, educational and spiritual. This research only reviews the inpatients charts, and there's no outpatient charts at this point. The ethics involved will be minimal because I'm interviewing patients' charts, not patients themselves. And my hypothesis is that there is increasing total numbers that we have, and that their types and presentations will be found in the demographics that I look at. There's increasing complexity of patients' needs that will lead to patients having increased unmet needs that we identify. So the implications. So by looking at demographical information and the cancer population at the Wollongong Hospital, by auditing 100 charts longitudinally to explore the care needs of patients, we're going to look at questions raised. So what are the medical team's understanding of the psychosocial needs? How does that influence the number of social work referrals that I receive? And what are the cancer survivorship statistics? What are the demographics of cancer patients in the Illawarra? So by exploring the data over time, we hope that's going to provide us with evidence of trends in cancer and unmet needs in our area and in our hospital. It's going to find out who our patients are and how many patients we actually have, and does it meet what we're feeling. The changes will become apparent that can be implemented to improve psychosocial service delivery. That's my biggest hope, and that's my passion, is to try and do it better. I'm hoping that from this, because social workers aren't very good at research, and hopefully we can only get better. Thank you.
Thanks very much, Cheryl. Just in case we've got time for a couple of questions from the audience. Any? There we go. Here's one down here.
Hi. How much do you think the quality of note-taking might influence the information you're going to find since you're only doing note audits?
That's one of the things I expect to actually find, is that we need to do it better. And I want to think about how can we actually do it better. And by bringing out the things that are being missed, hopefully it's going to reflect in the way that we do our psychosocial assessment, the junctions that it's actually done at, and it's going to provide me with the evidence to actually change practice.
Great. Thanks very much, Cheryl.